Do you ever feel unexplained heart palpitations, sudden bouts of fatigue, or notice a small lump in your neck? You're not alone. These can be clues that your body's hormone-producing glands are acting up. Multiple Endocrine Neoplasia Type 4, or MEN4, is a very rare condition where several endocrine glands like the parathyroids, pituitary, or pancreas develop benign tumors that can overproduce hormones. Even though the word sounds complex, think of it as a family recipe gone a little wrong. A tiny change in the body's instruction book makes several organs behave oddly at the same time. MEN4 is caused by a change mutation in a single gene called CDKN1B. This gene normally helps cells know when to stop growing. When the gene is faulty, cells can keep dividing and form tumors. The mutation is usually inherited from a parent in an autosomal dominant pattern, which means just one copy of the altered gene is enough to pass the risk on. However, about 1/3 of cases happen because the mutation appears for the first time in the person, a new mutation. Imagine a typo in a recipe that a chef copies to all his cooks. The mistake spreads to every dish they make. Explanation: because MEN4 can affect different glands, the signs can vary. Parathyroid tumors, high calcium levels causing bone aches, kidney stones, or feeling very thirsty. Pituitary tumors, headaches, vision changes like blurry vision, or changes in menstrual cycles and libido. Pancreatic neuroendocrine tumors may cause low blood sugar, stomach pain, or diarrhea. Think of it like a car with several warning lights on at once. Each light tells you which part needs attention. If you notice any of these symptoms together, it is worth talking to a doctor. Diagnosing MEN4 starts with a family history check. Does anyone in your family have similar hormone problems? Then doctors do blood tests to measure hormone levels, calcium, prolactin, insulin, etc. Imaging helps locate any tumors, ultrasound, MRI, or CT scans. The key test is genetic testing for the CDKN1B mutation. A simple saliva or blood sample can confirm it. Treatment is usually surgical removal of troublesome tumors, followed by hormone replacement therapy if a gland is missing. Ongoing monitoring is essential, regular blood work and scans, much like regular oil checks to keep a car running smoothly. Because MEN4 stems from a genetic change, you cannot prevent it in the classic sense. What you can do is reduce the impact. Family screening: if a close relative is diagnosed, ask them to get tested. Early detection means smaller, easier to manage tumors. Healthy lifestyle: staying hydrated, eating a balanced diet low in excess calcium, and regular exercise help keep bone and kidney health strong. Regular medical follow-up: keep appointments even if you feel fine. Many MEN4 tumors grow slowly and are silent at first. Think of it like a fire alarm system. You cannot stop the fire from starting if the wiring is faulty, but you can install detectors early and have a plan to extinguish it quickly. Research on MEN4 is still catching up because it is so rare. Recent studies 2022 to 2024 have shown better genetic panels that include CDKN1B, making diagnosis faster and cheaper. Targeted drug trials using mTOR inhibitors like everolimus that can shrink neuroendocrine tumors when surgery is not enough. Understanding the CDKN1B pathway, scientists are learning how this gene interacts with other cell growth controls, opening doors for future therapies that could correct the typo at the molecular level. While these advances are early, they give hope that one day MEN4 can be managed with medicines as well as surgery, reducing the need for repeated